A pleasant day to you, Doc. As of today, we, the researchers, will present our case study and framework evaluation and analysis of our given case statement. As a leader, let me introduce the researchers in this group. I, yours truly, Chris Daniel Peralta, Char Angel Caliet, Christine Joy Diamante, Ezra Pepe, and Janine Ondoy.
This is the given case state to our team. A 59-year-old man with emphysema, secondary to 50-pack year smoking history, with a temperature of 39.4 degrees Celsius, cold with mild cough and congestion for 3 days, shaking chills, sputum that looks like rust, and experienced sharp stabbing pain in his left lower chest.
This shows the patient's physical test before taking another test with 38.8 of temperature, heart rate at 110 bpm, blood pressure at 110 over 60 mm mercury, and lastly, respiratory rate at 28 bpm.
While examining the pulmonary, it shows that patients have presence of crackles, rhonchi in the left lower fields, and an expiratory wheezing. History of pneumonia in 500 BC. The name pneumonia was originated during ancient Greeks and named pneumonia, which means lung inflammation. While in 1875, Edwin Cleves was the first one to observe the bacteria which causes pneumonia under a microscope. In 1881, Louis Pasteur and George Steinberg, the two scientists, discovered the Streptococcus pneumoniae in late 18s. Hans Christian Graham and used as pneumonia in his Graham staining technique.
Between late 1800s and early 90s, pneumonia became the third leading cause of death globally. During the 90s, antibiotics were widely used in combating the disease. In 1997, PPB was developed. In 2000, PCV was produced. Signs and symptoms of pneumonia: fever, headache, dry cough, muscle discomfort, weakness, phlegm, shortness of breath, chest pain, muscle soreness, sweating, shaking chills, nausea, and vomiting.
Infants who determine pneumonia were vomit, fever and cough, agitated level 3, exhausted, lacking in energy are the signs and symptoms, while in older people you will notice they causes abrupt changes in their mental awareness.
The bacteria that causes bacterial pneumonia is Streptococcus pneumoniae, and it commonly inhabits the respiratory tract of the body. The upper airway of the respiratory tract is where the colonization of the bacteria usually happens. When organisms move from the colonization site to a distant, vulnerable place, pneumococcal infections happens or develop. As pneumococcus is inhaled in the distal airway, the bacteria grow in the alveoli, which causes pneumonia.
This time is characteristics of S. pneumoniae. It is a lancet-shaped, gram-positive, aerobic, and facultative anaerobic bacteria. Its size is about 1 micrometer, and lastly, a kind of pneumococcal infection with grown in blood, serum, or sugars.
Treatment and prevention. Uncomplicated pneumonia is usually treated with quinolone and microlides such as azithromycin, penicillin, or cefoxitamine is commonly used to treat complex or disseminated pneumococcal illness. Adult and pediatric vaccinations targeted pneumococcal capsular antigens. Quit smoking and avoid secondhand smoke, healthy diet, exercise, and proper hygiene.
Components to be examined were incomplete blood count CBC, sputum examination, sputum culture, C-reactive protein ESR, and chest X-ray ECG in laboratory tests.
CBC tests, or as we all know as complete blood count, helps in identifying abnormalities in the blood for any signs of diseases and disorders of the patient's health.
A sputum gram stain test is a laboratory test to detect bacteria in sputum samples.
C-reactive protein or CRP and erythrocyte sedimentation rate or ESR are known as acute phase protein, which reflect a measure of acute phase response.
A chest x ray can reveal whether you have fluid accumulation in your lungs or if your heart has enlarged and to assess the rhythm and electrical activity of your heart.
In this slide, you can see the CBC result of a person without and with pneumonia. Notice how the parameter changes. Next, sputum examination or the Graham stain smear sputum culture. Normal rate versus diagnosing a patient with a pneumonia.
C-reactive protein ESR first figure the CRP ESR normal rate, while the next figure CRP ESR of patient with pneumonia. Median and range values of C-reactive protein or CRP, B-type natriuretic peptide or BNP, erythrocyte sedimentation rate or ESR, and leukocyte count before and after the treatment in patients with pneumonia.
Chest x-ray ECG. The first picture is the normal chest x-ray, while the second picture is the chest x-ray of a patient with pneumonia. Notice the enlargement of heart and how hazy is the lower lobe is.
And now we're going to discuss the results and interpretation in each laboratory test. First is
With the given test results, the normal range of hemoglobin is between 13 to 17 g per dl. So patient's result shows that his hemoglobin is below the normal range, which is 8.4 g per dl. This indicates that the patient has low RBC carrying oxygen in his body, where hemoglobin is the protein in RBC which carries oxygen. In the patient's physical test, he has abnormal breathing. So, the normal respiratory rate of an adult is between 12 to 16 breaths per minute, where the increase or decrease in respiratory rate is commonly associated with any medical conditions. Hemoglobin levels below normal prevent the brain from receiving enough oxygen, where such breathing problems result from the lungs overcompensating to take in extra oxygen. Moving on, in hematocrit, the normal range is 40% to 50%. Patient's result shows 50%, which is within the normal range, indicating that his hematocrit is normal. In RBC count, the normal count is 45,000 to 5.9 thousand, while the patient's results show that his RBC count is high, which is 133,000. So, according to a study, a high RBC count is due to health conditions, which include smoking and low blood oxygen level. It was shown that the patient is a 50-pack-year smoker and has a low hemoglobin, which explain why his RBC count is high. Moving on WBC count, which is very important in the CBC test. So the normal count is 4,000 to 11,000. So patient's results shows that his WBC elevates, which is 12,600. The increase of WBC count suggests that there is a bacterial infection. So a WBC count of 10,000 to 14,000 with a clear left shift is usual for bacterial pneumonia. So when a WBC count of more than 15,000 shows a pneumococcal etiology. A WBC count of more than 20,000 indicates poor prognosis. Since the patient's lab result is 12,600, it strongly suggests that the patient has bacterial pneumonia. So moving on, in neutrophils, the normal range is 40% to 60%. Patient's results shows that he has 75% of neutrophils in his WBC. The increase of neutrophils due to infections or inflammations as well as cigarette smoking. In lymphocytes, the normal range is 20% to 40%, where patient's results shows a high number of lymphocytes, which is 42%. High lymphocytes indicate that there is a chronic bacterial infection in the body. In eosinophils, the normal range is 7 to 10%. Patient's result shows a normal eosinophil which is 8%. Lastly, moving on, in monocytes, the normal range is 1 to 3%. Patient's results shows a high level of monocytes, which is 6%. The increase of monocytes suggests that there is an inflammation or bacterial infection in the body. Lastly, in platelet count, the normal range is 150,000 to 400,000. So, as we can see in the results, patient's results shows a normal platelet count. So, with the results and interpretation given, the researchers conclude that the patient has an infection and inflammation in his body due to the elevation of WBC, and it suggests that it is in his respiratory tract due to the abnormality of his breathing.
According to Frederick 2007, the bacteria as pneumonia can produce green-brown or rust-colored blood. As pneumonia is classically associated with a cough product of rust-colored sputum. A cough product of scanty sputum suggested a typical pneumonia. Pleuritic chest pain or pain associated with deep inspiration is classically described or found in a patient with S. pneumonia. In some cases, when bacteria such as S. pneumonia gets into our lungs, pneumonia can be serious and it can be resistant to antibiotics. That is why even though patient Johnny Sue has been taking numerous over-the-counter cold medication, there is no relief in his situation, and still he has to use his Impratorium inhaler more often than usual. In addition, based on the result, the fever, chills, chest pain, and the sharp stabbing pain in his left lower chest that he feels when he coughs or takes a deep breath are some of signs and symptoms of pneumonia. The researcher conclude Johnny's sputum examination revealed that he is probably positive to culture for pneumonia based on his findings that he got more than just 10 bacilli during the initial evaluation of possible S. pneumonia. The results are strongly proven and show that the patient has an infection and inflammation in his body, as his sputum gram stain has the presence of more than 10 lancet-shaped gram-positive diplococci per high-power field, and provides strongly evidence that S. pneumoniae is the cause of his bacterial pneumonia. In his sputum gram stain result, it presented that the reason his cough produces productive sputum that looks like rust is because he has a condition that causes its bleeding, which raises the probability that he has an infection called as pneumonia.
Pneumonia can be diagnosed by a patient's temperature, and the laboratory tests are erythrocyte sedimentation rate or ESR, leukocyte count or LEUC, and C-reactive protein or CRP values. CRP values are especially high in patients with pneumonias caused by S. pneumoniae. The following are the results of the test with a positive CRP. CRP measured in milligrams per liter. According to the Mayo Clinic Organization, CRP intervals more than 200 mg per liter were linked with likelihood ratio plus greater than 5. Pneumonia often has markedly higher CRP levels, and in general practice, a high CRP level has been proved to be a reliable indicator of this illness. The patient has pneumonia, therefore, he has a high marked level of CRP. It tells that agglutination is present and it is CRP negative.
Bilateral lobe opacity is in all probability due to PDP of undetermined activity pneumonia. Both lower lobes, atheromatous aorta, an electrocardiogram is normal. An X-ray of the chest reveals a pleural effusion on the left side and a thick infiltration of the left lower lobe. Minimal haziness is seen in the left lower lobe with blunting of the sulcus. Heart is mildly enlargement with a CTR of trachea at midline. Diaphragm and right claustrophrenic soli are unremarkable. Spars are seen along the articular margins of the thoracic spine. The researcher concluded that the pneumonia left in the lower lobe is minimal, as well as the pleural effusion. It had a mild cardiomegaly, which means mild enlargement of heart, and thoracic spondylosis.
And now the patient's final diagnosis: bacterial pneumonia, a pneumonia caused by Streptococcus pneumonia, and the color of the patient's sputum indicates that his condition is worse. Therefore, we conclude that a 59-year-old man diagnosed with bacterial pneumonia, the specific bacteria causes a Streptococcus pneumonia. Streptococcus pneumonia causes minimal tissue necrosis. Pulmonary pathogens demonstrate that S. pneumonia is capable of destroying lung parenchyma.
It may give us stress, but we have gained more knowledge about diagnosing a patient with pneumonia. So, guys, what did you all learn?
What I have learned, Health Information System or HIS plays an important role in sputum examination and sputum culture test. It can help doctors to easily rule out significant information so that healthcare providers that order gram stain or culture tests can use the information to help them diagnose and treat certain bacterial infections such as urinary tract infections or UTIs and bacterial pneumonia.
I learned that health information system provide information about specific providers or healthcare care organizations, such as commonly used treatments or interventions associated with the best outcomes, especially in getting the CRP and ESR. It helps the healthcare professionals in quickly locating data. It makes everything goes more smoothly.
Well, the Health Information System, or HIS, is the one of that leads everyone in citing and collecting significant results. These systems make it simple for healthcare professionals to access data on large-scale settings, such as trends in community health, and this is also helpful for obtaining data for medical students' case studies.
While doing my part, a health information system makes it simple for healthcare professionals to learn about larger settings, such as changes in community health. A crucial part of the HIS is played by X-rays also. A picture of body interior organs is created using the imaging technology known as an X-ray. The biggest benefit of routine chest X-ray will help detect lung abnormalities, especially new and small lung tumors. Early detection in the stage of curative surgery will help.
Interesting. As for me, HIS have been storing patients' laboratory and examination results for medical practitioners to easily access. The stored data and results of examinations can easily be accessed for future and research purposes. Most especially in CBC, practitioners are able to know the normal range of a cell and the number of that kind of cell in a patient's body. They are then able to provide interpretation and identification of disease. I see we learned so much from it. Congratulations, guys! And that brings us to the end of the presentation of our case study. Thank you for your time and attention, Doc. Have a great day.